So a warm welcome to all the participants joining us for this session on improving the quality of complementary feeding. We are delighted that you have joined us. As you join, you will note that we have translation available in 5 languages. You will see the globe at the bottom of your screen. If you click on that, you will see an option for English, French, Russian, Spanish, or Arabic. So you are welcome to choose the language of your choice for this meeting. We would also like to remind you that the chat box is only for introducing yourself. So please feel free to go into the chat box now and say hello and tell us where in the world you are from and perhaps your organization. The Q&A box will be where you will post any questions that you have for any of our speakers. So we ask you to only use the Q&A box for questions. We will not be taking any questions that are in the chat box. So the chat box will be for saying hello. And we look forward to you all introducing yourselves in the chat box. Let us know your name and where you come from. So warm welcome to our meeting. We will be starting in a few minutes, but we will just let everybody join at the moment. So those of you that have joined, welcome. And hello, Tai Girma from Ethiopia, Alex from Italy, Larry from the WHO, Lisa, lovely to see you from the USA. And so it really is lovely when people say hello. Hello, Alyssa from HKI, Helen Keller International. And lovely to see all the different people joining us, Iona, Klazine, Sam, Tomoko. So yes, everyone say hello in the chat box. And indeed, I see we have some people, of course, who it is good morning. Some people it's good evening. But it is lovely to have you all with us. And no matter what time of day, you are most welcome. A reminder, as a few more people have just joined, that translation is available. Please go to the globe at the bottom of your screen. And there you will have a selection of languages. You can join us in English, French, Russian, Spanish, and Arabic. So we look forward to you all being able to hear us in the language of your choice. And so we're going to get going with our meeting today. We are delighted that you've joined us for session 4 of 8 sessions that are being hosted by UNICEF and the WHO this week as we start preparing for the Nutrition for Growth Summit happening at the end of the year. And it is really important that nutrition is, of course, a cornerstone of what we're going to be talking about at the Nutrition for Growth Summit. But it really is important that when countries are looking at their commitments, that they also consider commitments around improving the quality of complementary feeding. And that's what we're going to focus on today. We're going to have some background information on the recent UNICEF report, and then we're going to have some country sharing. And hopefully we'll still have time for then some questions live. So immediately, let me introduce you to our first presenter, Grania Maloney. And Grania is the Senior Advisor for Early Childhood Nutrition at UNICEF headquarters in New York. And Grania is going to take us through the Fed to Fail report and an overview of the findings. So Grania, over to you.
Thank you so much, Jane. Good morning, good afternoon, good evening, colleagues joining us from around the world. It's so great to see so many countries online. So I'm delighted to have the opportunity to share with you all the key findings and key highlights of a new flagship report just released by UNICEF. The report, called Fed to Fail, outlines the crisis of children's diets in early life. So we're going to start by a short video that summarizes some of the key findings.
Unfortunately, we're not getting the sound, Holly. So bear with us, everybody. Hopefully in a moment we will get that video back. Otherwise, we will continue without the video. Let's see how we go. Well, hopefully people can just read the wording as it goes along. You're on mute, Grania.
Thank you so much, Holly. And colleagues, apologies for the volume, but it was basically some music, but you would have seen the key messages alongside the bottom of the pictures. So let's talk about this report. This report aimed to answer 3 core questions that we feel have not been reported on at a global level. The first question is what, when, and how are children aged between 6 and 23 months being fed globally, and have there been any improvements over time? The second question is what are the main barriers that prevent caregivers and families from feeding their young children nutritious, safe, and age-appropriate diets? And the third question, of course, is what kind of solutions do we need? How can we transform systems, including the food system, the health, the social protection systems, to remove these barriers and better support caregivers and families? So the report draws on a source of 5 key data sources, the first of which was quantitative data on young children's diets. Now, this is an impressive data set that UNICEF has, and we collected with our partner governments and with WHO and other partners. And it's data from 135 countries and territories across the world, with trends from 50 to 86 countries between the period of 2010 and 2020. And in fact, this data represents 90% of all children between the ages of 6 and 23 months across the globe. So a very comprehensive representation. The second point that we looked at was regional analysis of national policies and programs. And this is basically to look at the determinants and drivers across all 7 UNICEF regions as we classify our regions. The third piece of information was looking at focus group discussions with the mothers of young children. And then the fourth was looking specifically at what happened during COVID. How did COVID impact on child nutrition services, household food purchases, and then children's diet? So this is information, again, we collected through our partnerships at country level with governments and civil society. So what are the 8 key findings? Now, the first finding, I think, is not surprising, but it confirmed that children are not fed enough of the right foods at the right time. The second, children's diets have seen little or no improvement in the last decade. The third is that poor diets are not affecting all children equally across and within regions. The most vulnerable, the youngest, the most deprived children in the most deprived areas, of course, are being affected more. And this is particularly apparent in sub-Saharan Africa and South Asia compared to other regions. Disparities in children's diets persist within countries, have not narrowed. And again, within countries, we see significant disparities between children in the rural areas compared to those in the urban settings. Again, that these children are not doing as well as children in the urban settings. The fifth finding is that families are struggling to find and afford nutritious foods for their children. And this is something we can all relate to. When you go into the supermarket, what are the cheapest foods that are available? They tend to be the ultra-processed foods, the foods that you do not want to be giving a growing baby. So being able to access nutritious food in the local markets and then being able to afford that nutritious food remains a major barrier. We've also seen that children's diets are constrained by social, cultural, and gender barriers. Who makes the decision in the household about which food is purchased? Who makes the decision about how food is distributed across the household? All of those factors are constrained by social, cultural, and gender barriers. The seventh finding was that unhealthy processed foods and drinks are widely accessible and heavily marketed. And this is becoming more and more apparent and more concerning. And specifically during the context of COVID, when income levels were reducing and families were having to make choices about what food to purchase, unfortunately, many actually went ahead and purchased unhealthy foods. And we found that in our reports that very high proportions of children were receiving at least one ultra-processed food or drink in their day when we did these studies. And that's, again, just very young children between the ages of 6 and 23 months. What's very worrying here is that tastes and flavors are actually generated and defined during this time period. So if we don't address taste preferences and get children used to drinking plain water, it sets them up for challenges later in life. And then finally, the last major finding was that policies and programs to improve young children's diets are not prioritized, and again, being further eroded by COVID-19. So moving forward, what we would like to highlight today, and this is taking us on our journey to the Nutrition for Growth Summit, are bolder actions and greater accountability for children's diets. And we have identified core actions that need to happen to transform the food system. One is that we need to increase the availability and affordability of nutritious foods, including fruits, vegetables, eggs, fish, by incentivizing their production, distribution, and retail. The second is we need to implement national standards and legislation to protect young children from unhealthy, processed and ultra-processed foods and beverages and harmful marketing that target children and families. The third is we need to use multiple communication channels, including digital media, to reach caregivers with factual information and advice on young child feeding and increase the desirability of nutritious and safe foods. And you may remember from that video the beautiful image of the little girl who was taking that piece of tomato like it was the most delicious thing she could ever eat. That's what we want children to desire, is healthy foods. We need to expand caregiver access to quality counselling and support on young child feeding by investing in recruitment, training, supervision and motivation of community-based counsellors and health workers. We need to deliver dietary supplements, home fortificants and fortified complementary food to young children at risk of micronutrient deficiencies, anemia and growth and development failure, because we know that there are many parts of the world and within countries that do need that extra support and extra supplements to meet their nutritional needs. We need to design social transfers, cash, food and our vouchers that support and do not undermine nutritious and safe diets in early childhood, including in fragile settings and in response to humanitarian crisis. We need to use social protection programs to improve caregivers' knowledge, as well as increasing their access to food about young child feeding by providing education and counselling and by encouraging the use of health and nutrition services. And then finally, we need to position young children's right to nutrition, nutritious and safe diets as a priority in national agendas and policies across different systems. And when we do this, we need to then strengthen public accountability for young children's diets by setting targets and tracking progress through sector-specific monitoring systems and household surveys. And finally, as we continue to do this work, we need to conduct research to understand context-specific barriers, enablers, and pathways to improving the quality of young children's diets. Now, this report and all of the related resources, such as the data tables, the video, and other important resources are available, and they will be posted in the chat box now. So we welcome you all to have a look and to read up on this report. Thank you very much, Jane, and back to you.
And thank you, Grania, for a very comprehensive covering of the report. And I say also thank you to our translators, because I know she spoke quite fast, but we trust that you all were able to keep up. And as Grania has said, the links are in the chat box. So feel free to make sure that you link to the report. It is a sobering report, but a very important report. And the link to the video that we showed at the beginning is also available in the chat box. And as you can see, the report available in all the languages. So do make sure that you download it and read it. We always in these sessions appreciate hearing country stories. And country sharing is a very big part of what our journey towards setting our commitments and actions is. We can learn so much from other countries who have gone before us and who have begun doing some of these things. So we are going to have now sharing from 4 of our country colleagues, and it is really wonderful to have them with us. I know for many of them, it is different times of the day, and so it is a pleasure that they have been able to join us. And you can see I am going to start by sending us on a virtual plane to Bangladesh. And here in Bangladesh, it is lovely to see our colleague, Dr. Islam Bulbul. And Islam is from the Tana Health Family Planning Officer, and he is the technical support to Sun Country Focal Point at the Ministry of Health and Family Welfare. So it's really going to be interesting to have a sharing on Bangladesh and what it's been doing, I think especially post-COVID-19, if I'm right, Islam, on improving diets of young children in Bangladesh. Over to you.
Thank you very much. Thank you, WHO and UNICEF for arranging such a wonderful webinar. You know that we have already learned from Granny's presentation that the 6 to 23 months of age children are very much, important to us. So complementary feeding is very important, you know. So I will go through a few slides to actually describe our situation, and I will try to tell you a story of Bangladesh so that we can take some decisions as well as we can learn something. You know that Bangladesh has made considerable progress in stunting reduction in the past decades. And however, the reduction rate is, in a way, we have to accelerate it if we wanted to achieve the SDG goal. One of the underlying factors for the stunting in Bangladesh, we have identified the poor young children's diets. At the same time, reduction in wasting requires also additional attention. If you look into my presentation, PowerPoint, that is minimum acceptable diets, it was in 2014-23. However, we have improved up to 34, but long way to go still. But if you see about the quintile, MAD among the households in the poorest quintile is less than half compared to that of the wealthiest quintile. So low minimum acceptable diet means that dietary diversity is very poor. Also, I mean, if we look into the affordability analysis, so in particular, most of the children of the complementary feeding age, their needs for the vitamin A and vitamin B12 could be affordable made through consumption of beef liver, I mean, both nutrient, chicken liver, both nutrient, and dark green leafy vegetables as well. If you go to next slide, so I will see show you the current situation in our country. If you look into the policy strategy as well as the guidelines, what we have made so far, you know that Bangladesh is much more aligning with the global strategy as well as global policy since our independence in 1971. So we have given importance in our constitutions to improve the nutrition situation of our people, especially the children as well as the mother. So we have actually made our different ways from the different ministries. You know that nutrition is not only the responsibility of the Ministry of Food, but also we consider 22 ministries under working Bangladesh National Nutrition Council. So we have Ministry of Planning. They made 8 5-year plan as well as National Social Security Strategy 2015. And also from Ministry of Health, there is a multi-sectoral second national plan of action for nutrition. And under this action plan, we have revitalized Bangladesh National Nutrition Council. We have made district level coordination committee as well as sub-district level coordination committee so that everyone can bring under one umbrella to improve the situation of the nutrition, especially the situation of the complementary feeding. As well as if you see about the non-communicable disease multi-sectoral action plan 2018-2015, so that we can provide importance on healthy diet as well as healthy food, especially for the children. We have National Nutrition Policy, though BMS Act as well as IYCF strategy. So all these plans as well as strategy as well as action plan provides importance to have young children's diets important. And also if we look into the Ministry of Food, they have food and nutrition security policy that is actually give us a glimpse of how it is important for the young children's dietary diversity, as well as we have country investment plan, Food Safety Act, and finally promotion of the nutrient dense complementary feeding 6 to 23 months of age. So if you go next slide, then we will tell you what are the focus needed for commitment to improve the complementary feeding. If you look into Granny's presentation, he has I actually identified almost 8 findings that is very much important I have seen. She has rightly mentioned about one is policy level. So if you look into the BMS Act 2013 as well as the Rule 2017, we have developed action plan for IYCF strategy.
4 minutes left.
Yeah. And also if you see about the institutional level, we have need to enable the capacity. And finally, what is actually we face the challenges that is nutrition is provided from the most of the health facility based services. But this is very much important to shift it into community-based services, especially the counseling as well as making affordable for the parents so that they can actually buy nutritious foods or vegetables or any sort of nutrient-dense foods for their children. Then if you go to next slides, and also one important thing is UNICEF's global strategy for the complementary feeding is also important. What are the drivers for the commitment, and what are the lessons we have learned? Actually, if you look into accelerated stunting, wasting reduction, and halting the overweight through the improved young children's diet is very much important area where we have to provide most importance. Secondly, our policy what are the policy we have? This is also very much friendly to us to improve the complementary feeding. Finally, evidence-based advocacy. This is very much needed for the coming days, because we will going to start our next sector plan, as well as we are actually going to have our next 5 years plan as well, and country investment plan. So all these plans we need to provide special importance so that we can include the complementary feeding, one of the important areas to this pathway. Currently, Bangladesh have much more, so many programs where National Nutrition Services provides the complementary feeding practices, as well as the counseling, and also our social security planning. So all these are providing services to the people. So I think I can say something about our Bangladesh perspective. But what I will say in the end line, that everybody have come together to invest more on improve the feeding practice for the children, especially 6 to 23, to achieve the global SDG goal and as well as country level. Thank you very much.
Thank you so much, Islam, for sharing, and thank you also for keeping to your time. Really appreciate it. And I'm sure we might get some questions in the Q&A box. I see looks like there might be one there already. So it would be really good if you could take a look there as well, Islam. Thank you very much. So we now have on our round the world ticket, we're heading from Bangladesh to Ethiopia. And it is a pleasure for us to welcome our colleague from Ethiopia. And it is lovely to see Dr. Meseret Zalalem, who is the director of MCHN at the Ministry of Health in Ethiopia. And we are so glad that you could be with us. And we really know that one of the key issues when we're looking at improving complementary food is how we address issues within the food system. And I really think what's going to be exciting is that Meseret's going to be sharing with us how Ethiopia has used a food system innovation and intervention to improve complementary feeding. So lovely to have you with us, and your 10 minutes starts now. Thank you, Meseret.
Thank you very much, Johnny, and also thank you very much, colleagues from UNICEF Country Office for partnering with us, and it's really an honor to be with you with this virtual platform. Good morning, good afternoon, good evening, everyone, wherever the time zone you are. I'm going to really present to you improving the quality of complementary feeding in Ethiopia. I will take you through this 10 minutes on our experience. Lovely to share our experience with this very short time. So when we start from the diet diversity staggering, you can see Ethiopia is almost all the country has a very high proportion of children not meeting the minimum diet diversity. And also in 2019, pockets of improvement has been observed in central Ethiopia. So we are trying to really, based on the evidence, trying to respond to the need based on the findings that we have, and then surrounding the capital Addis, and there are some improvements, and also in areas in northern and east part of Ethiopia. So the other thing is, even in the highest wealth quantile, there is a less than 30% of children with the minimum diet diversity, more pronounced and growing inequalities, which has been observed for nutrient-dense food. So in general, I can say still there is a lot to do in terms of addressing the minimum diet diversity, and also specifically for the spectrum of the diet, like egg, fruit, and vegetables. There are promising activities in the capital of Ethiopia, in Addis, and then in some part of area, but it really shows us we have to really do our best to improve this one. Next slide, please. And also, I already said this one. You can see from this figure, the breastfeeding infants from the year 2005, based on the EDHS findings that we have every 5 years. So we have the 4 evidences, including the mini EDHS that has been conducted in 2019. So you can see in 2005 what was happening, and then 2011, 2016, and 2019. So you can see the grain root tubers, and then the dairy, legumes, and nuts. You can see the diversity, how it really different from the diversified food element, and also from the year to year, you see there is also a difference. So it's only 7% of children having a minimum acceptable diet. So this figure really speaks a lot. That's why we are trying to mitigate. I will show you later on that. So we will share, how we can, based on this finding, what is the country experience, in fact, to share with other countries as a member states. Number one, we have within a policy, we have a 10-year costed strategy plan for the coming 10 years, along with the national development plan from the year 2021 to 2030. So we have, this is a multi-sectoral approach to reduce malnutrition. The other thing is, within each nutrition roadmap, we are also ensuring that the global action plan for the prevention and treatment of wasting has a strong component around diet diversity. And also we are trying to work on the game-changing action in the food system. So we have 22 game-changing actions, which has been included in the food system, which is already identified, and these are the top pillar agendas in the food system. So we have a policy element. There's also a roadmap, nutrition in every aspect of the roadmap. We have also a game-changing items, identified elements in the food system. So we really much honored to collaborate with UNICEF for this matter as well. So we have also innovated to boost the trend of diet diversity for the first 1,000 days window. So we have an objective of this, like develop local, accessible, and affordable food solution for pregnant women and young children to increase the diet diversity. So we're trying to really mitigate and respond to this need, through financial viable private sectors collaboration. So we are partnering with the UN agencies as our partners, plus the private non-profit profitable actors. So these are the works that we are doing. So one of the very important showcases, you can see the egg powder. So this is a very important exercise that we are really working with our key partner, UNICEF. So with a tripartite with the private sector. So you can see longer shelf life if we can use the egg powder, cost effective for transportation in terms of different elements, reduce food loss, easily integrated in the traditional recipe of even during fasting season, and 1 egg a day per child to expensive, and also less could be affordable. So this is the things that we are doing our best. So its nutritional advantage, it's scientifically proven. So that this is one of the innovative activities that we are doing with our partners. Next slide. Next slide, please. So where are we now? from the lab to the local product achieved. So we were trying to check on, in the year 2020, we selected the company and equipment required for the large production. So we went from the February to the November. You can see laboratory production and the first testing of the egg powder has been done. From the local consumers insight has been also done. And also from the year 2021, March to June, we developed the MOU, the Memorandum of Understanding between the Ministry of Health, our ministry, and the private sectors to license the equipment. It's already signed, so installation has been also done. So these are the activities has been already completed. So now we are gonna to really work on the increased access for the poorest through the public distribution in the collaboration with the Sakota Declaration and others. When I say Sakota Declaration, this is the area where the very high hotspot area for a high burden of stunting, where we piloted the Sakota Declaration, so that this is the area where we will invest on this egg powder. Next slide. So when we see the child diet multi-sectoral approach to sustain our egg powder approach, one is you can see this picture really shows you, gives you an insight. So you can see investigates local products of animal feeding, which is reduce tax of imported animal feeding. We improve the value chain of egg production through the egg hub and other alternatives. We collaborate with Ethiopian factors and also advocate for reduced VAT for nutrition foods, and also we work on promotion of the healthy diet. It's not only the production and availability of the egg powder. What really matters is behavioral change along with this all across this chain. So that these are the important investments that we are working for, and the authorities or the sectors which has a direct role in this egg powder is, of course, Ministry of Health and also Ministry of Finance and Economic Commission. Finance and Economic Minister and Minister of Agriculture, and also Industry Commission, and also we have also the media, the mass media. Also, these are the stakeholders. So this is, I think, really a showcase how we are really navigating this egg powder as innovation. Next. So the national. Okay, please next slide.
That is the last slide that we have, Doctor.
Yeah, so at the last point, the Ministry of Health as the focal point of the nutrition multi-sectoral approach would need to coordinate interventions which requires more than one ministry. In fact, we are the chair for the National Food and Nutrition Coordination. We are really coordinating the different sectors. And the co-chair is the Minister of Agriculture and the Minister of Education. So the same coordination is happening in the sub-national area. So with this, I would like to really pass my gratitude to our partners, particularly for UNICEF and other actors. And thank you very much for this platform again. Over to you, and thank you.
Thank you very much, Dr. Zelalem. It was really interesting to hear about such a new and interesting and different approach to improving complementary feeding. Please keep an eye on the Q&A box because there might well be questions that we'd ask you to take a look at and begin answering there. So now it is my pleasure to take our plane back in another direction, because we're going to head now across virtually to Russia. And it is wonderful to be with our colleagues, and a special warm welcome to Dr. Anna Kontsevaya. I probably didn't say that quite right, but you are warmly welcomed. Anna is the Deputy Director of Science and Analytics at the National Medical Research Center for Therapy and Preventative Medicine. And it's going to be really exciting to learn yet something else, another important approach to improving complementary feeding. And that is Russia's experience in developing a nutrient profiling model. So Anna, it's over to you, and thank you for being with us.
Dear Jane, dear colleagues, it is my great pleasure to take part in this extremely interesting webinar and share our experience of adapting and using nutrient profile model for these purposes. Next slide, please. Russian Federation is in fact a huge market of complementary food for infants and young children.
Anna, I'm just going to ask you if you can go a bit closer to your microphone. We are battling, the interpreters are also battling to hear you.
Thank you, thank you. Russian Federation is a huge market for complementary food for infants and young children. We are in fact the third one after China and United States. And also our country provides substantial impact on the markets of neighborhood countries inside the Eurasian Economic Union due to common producers of the infant foods and other and common legislation. The legislation related to food labeling is different compared to European countries and some other parts of the world. And on the moment, there is no requirement to put amount of sugar, salt, saturated fat on the package. And on the moment, there was no comprehensive investigation of the complementary food for infants and young children in Russia. Next slide, please. What we do, we took the WHO nutrient profile model, which was developed in 2019. Its main goal was to end the inappropriate promotion of baby foods for infants and young children in Europe and prevent marketing of the food high in energy, fats, and free sugars and salt. We took this nutrient profile model and adapted it to Russian specifics and then use it. Next slide, please. What we did, we provided the cross-sectional study to assess the suitability for marketing of baby food, target the children and infants aged 6 months to 36 months in Moscow in the Russian Federation. So we analyzed the food labels of these food packages and then grouped this food in the food categories. Next slide. Next slide, please. And what we found? We found that many products for this very vulnerable group of children had missing nutrition information on the labels. Therefore, this product could not be assessed against the nutrition profile model. Consequently, the full assessment of the suitability of baby food on the Russian market could not be conducted. And there was no one product which can be said that it's fully meets the requirements of nutrition profile model. Here is the exact numbers. In 95%, the information on the total sugars missed in 78% information of salt or natrium missed, and in 95% the information on saturated fat were missed. Next slide, please. And mainly we come to the next, the following result.
Anna, I'm just going to stop you once more because our interpreters are not able to hear you and interpret. So we will just apologize to our colleagues that we're looking for interpretation. You might not get interpretation, but thank you, Anna. Let's see if we can continue, but it might mean there is no interpretation. Thank you.
Yes, sorry for this. And as for food labeling results, 60% of the products were explicitly marketed as suitable for infants and young children, either including minimum age under 6 months, or images or text messaging that the product is suitable for babies under 6 months. And 41% of the products included added sugar or sweeteners in the ingredient list. And 48% of the products included sodium or salt exceeded the nutrition profile model threshold. Next slide, please. Also, we compared the products of the same transnational company, Nestlé company, which produce the same products in different countries from their portfolio for infants and young children aged from 3 to 36 months. And we compared the information about total sugar and salt on the packages in the countries listed on the slides. And we found that only in Russia, this company produced very little information on the packages, but in European countries, as well as in the Philippines, the same product had this information. Next slide. As for the aspects of the marketing for the babies less than 6 months old, then in Russia we have this in 50%. It is more than in most of the analyzed countries except Malta. There these numbers was 8%. Next slide. Our conclusion is that nutrient profile model is effective tool to investigate the commercially available complementary foods for infants and young children from the position of food labeling and marketing, which allows us to get arguments for advocacy. Compared with the European Union countries that piloted nutrition profile model, Russian Federation showed much higher prevalence of baby food unsuitable for marketing for these children. This difference was driven by missing nutrient content on their food labels, sugar, salt, salt, due to insufficient regulation in the area of food labeling. Voluntary restrictions and commitments of food industry work selectively. Transnational companies use different strategies in different countries. And if there is no strict requirement in providing nutrition information, they do not do it. Example of Nestlé. Strong regulation policies for better labeling of food targeted at this age group is needed to empower parents to make informed and healthy choice for their babies. Thank you for your attention. It's the end of my presentation.
Thank you very much, Anna, and my apologies to all our delegates for the very poor quality of sound, but you were able to see the slides and hopefully be able to get some of the key information from the presentation. And to our translators, we also apologize that you were battling with hearing the sound, but thank you very much, Anna. So we're going to climb on our virtual jet and we're going to head back to Africa, and we're going to stop and visit Tanzania. And it is a pleasure to have with us to present on behalf of Tanzania, Paul Sangawe. Paul is the Coordination Director of Government Business in the Prime Minister's Office. He is also the Sun Coordinator for Tanzania, and he is the Tanzanian Sun Movement and N4G lead. Paul is a very busy man. I keep bumping into him at all these various meetings, but he always seems to have his hand on the subject. And we are going to have Paul be sharing with us today around how national policy actions, and I really like it, Paul, that we kept you for last, because we always think policy comes first, and it is very important indeed. But we've heard such other interesting examples of those policies being taken actually to actions. We've seen the egg powder intervention, we've seen the nutrition front of pack labeling, and all of those are only enabled if we have good policies. So Paul, I'm going to give you the floor for your 10 minutes to share with us on Tanzania's action framework to improve the quality of young children's diets. Over to you.
Thank you very much, Jen. Good morning, good afternoon, and good evening to all participants. Thank you very much, UNICEF and WHO for arranging for this webinar on improving the quality of complementary feeding. But also thank you very much for giving opportunity to Tanzania to share experience on this. We have only 10 minutes, so I'll cover very briefly on the situation in Tanzania, but also on the policy landscape, action framework, and the consultation and the stakeholders participation, and then finish up with what lessons can you learn from Tanzania. So can you go on the first slide, please? Thank you. On overall feeding situation in Tanzania, like many other countries, this is still a challenge, and we have 1 out of 3 children from 6 to 23 months in mainland receiving a minimum acceptable diet. We still have inadequate access, mainly caused by economic and physical condition to nutritious and safe food. And this now is still one of the main drivers of the persistently high burden of undernutrition among young children in Tanzania. More specifically, young children, evidence show that young children in Tanzania still lack several essential micronutrients. And still affordability of quality diets also remain a challenge, just as in many other developing countries. And on top of that, around 59% of households cannot still afford nutritious diet. So as for Tanzania, as many other developing countries, this is still a very big challenge. Can you go to the next slide, please? Now, based on these challenges which I've explained, we try to do a policy landscape analysis, try to see how strategies and the policies address this problem. As you can see, there are many white spaces, and those are gaps. So after doing all this policy landscape and analysis, we came into conclusion that we still, the policies and strategies can be improved in order to address the challenges that we have and the issues of complementary feeding. Because only few policies across other sectors which are key, they don't actually aim to improve children's diet in Tanzania. So very few prioritize, but also ministries have very few interventions to monitor how we progress on these challenges. Next slide, please. After explaining the problem and also the policy analysis and the gap, now we came with the action framework to improve quality of young children diet. And this action framework is comprehensive enough that covers, you can see all key sectors of agriculture, but health and nutrition, water, sanitation, hygiene, but also social protection. And on the strategic actions, we are addressing all 3 main areas. That means areas of policy, institutional, including both public and private, but also community, and also at the household level. But also we, on the side of enabling environment, we are making sure that we have enough influence, that we build enough capacity, but also have sustainable solutions that can help the community move forward from where we are now. So based on this approach, which goes around all life cycle of a human being, we brought this from the global perspective on improving child diet, but also the regional framework, SADC, Southern African Development Community, adopted a framework that was domesticated in Tanzania and now is also reflected in the National Multi-Sectoral Nutrition Action Plan. So all key sectors, as I said before, have been included in the national plan. So we expect that the adoption of the global and regional framework in the national framework will eventually help our country to move forward and of course have a positive impact because quality diets are at the center of promoting good growth, of course, survival and development of young children. We expect that this implementing the framework is going to help us to solve the problem of undernutrition, overnutrition, and macronutrient deficiency in Tanzania. And once we have a healthy population, we hope, of course, we are going to improve on the engagement of our population and people in economic activities, but also increase productivity, but efficiency, but also we want to have a survival rate high. That means also the labor force is going to improve. Next slide, please. So keeping an eye to the National Multi-Sectoral Nutrition Action Plan that I mentioned earlier, the main drivers of what we did was mainly who had basis on the gap analysis that we did. That was very important to inform us on what actions should we put in our national action plan, because that gave us policy and the strategic gaps that we had to address. But we had completed the National Multi-Sectoral Nutrition Action Plan 1, so we did a review. We had a midterm review that also gave us where we are and what were the issues to be addressed in the second National Multi-Sectoral Nutrition Action Plan. But also, the main driver of this was from the directives and the policy guidance from the global and the regional commitments. So all these were the basis of our strategies and policies that we are adopting now for the next 5 years. That will improve the diets of young children. So in terms of process, the preparation of the strategy was evidence informed and also aligned to regional and the global framework, but also part of the strategy includes the interventions early childhood nutrition. And also this strategy has been costed, and therefore we are well aware that how much these interventions are going to cost over the next 5 years. And of course, I said in the beginning, it's going to address the issue of triple burden of malnutrition. So it's a comprehensive document. We hope that investing in child diets is a core to addressing all forms of malnutrition in Tanzania, and hence it remains a priority for the government. So in terms of preparation and in the consultation process, next slide, please. In terms of the consultation and building up into our policy document, I can say 2 main keywords in this slide: coordination, proper coordination, and the comprehensive consultation process. That means that from the regional framework that was adopted and domesticated to the national framework, all process was done through consultation process. And this was from the government, whereby the Prime Minister's office was lead as a coordinator, but also we included other government ministries like Ministry of Health, Ministry of Water, and the other government ministries, but also UN agencies, but also non-governmental organizations, research institutions. All these were involved during the consultation process. Next, please. Next slide, please. This is the next slide. And so from all these processes, what can we learn? What lessons can we tell others as a good story to be adopted? I think number 1 is that evidence generation is to inform policy analysis and evidence. Because as you can see from my presentation, the first step we did is identifying gaps. But the next thing is the integration now of this policy into all other sectors. Because nutrition is not only an issue of one sector, so we had to make sure that all these issues which are being domesticated, they're also integrated in other sectors. But number 3, which is also a key lesson, is the stakeholders consultation. As I said, you can see all important groups were consulted throughout the process. And this is very important to make sure that the implementation is successful. But I think also another key point to take home is the integration of the global framework, regional framework, but also bringing them into at the national level. But timing also is of essence, because in our country, it's good enough, and we are lucky that we have been able to link all these key documents that are going to lead us over the next 5 years to make sure that they talk to each other and they remain priority at the political level, but also at the government. So when you go in through the election manifesto of the leading party, you will see that we have included key issues. When you go to the development plan for the next 5 years, also you find we have interventions. When you go to the National Multi-Sectoral Nutrition Action Plan, we also see that we have included these key interventions. And now we are going to the commitment in the N4G. Also, we have included all these key commitments. So I think timing of development of these policy documents is also very important to make sure that the timing, the reporting time, monitoring and evaluation goes together, and we are talking about the same thing in all processes, but also reporting at the national level and at the regional level. So Jen, I think with the 10 minutes, I think this one will do, and thank you very much for listening, and you are all welcome to Tanzania. Thank you very much.
Asante sana, Paul, and we long for when we can come back to visit all our panelists in their various countries. And thank you so much for also sharing the Tanzanian experience on really making sure that the policy area is well covered so that implementation has policies within which to fit. And hopefully now those policies will soon turn into actions as we see the next action plan coming together. So we're going to now go to some questions. We've had some wonderful conversations in the Q&A box. So firstly, a big thank you to panelists that have already answered some of the questions. I might still come back to you to answer some of them live for everybody to hear. But I'm going to start, and perhaps we can end the PowerPoint presentation so that we can have our panelists on the screen. Thank you. And going to start actually by, yes, Grania, you've put on your camera, so great. If all our speakers are able to put on their cameras, that would be wonderful. Grania, I'm going to start with a question to you. One from me, and then one that was in the chat box. So the one from me is, when I saw the title of the report that UNICEF recently launched, Fed to Fail, I felt deeply depressed. When I read the report, I also felt deeply depressed. But I think there is some good news in there. So I'm going to ask you to perhaps firstly and briefly just share a little bit of the good news so that we can feel not so depressed. And then I'm going to ask you to also briefly address the question in the chat box, which was, what has UNICEF seen about the trend in complementary feeding during the COVID-19 pandemic? Give us some feelings around what's the cause of that. So Grania, you first, and then Dr. Bulbul, I'm warning you, you're up next with a question.
Thank you so much, Jane, and thanks to all the presenters. I think they were fantastic presentations of the great work ongoing in many countries. So indeed, the first question, and you will notice that we deliberately had a question mark on the title because we want to show that there is hope, there are opportunities, there is time. However, currently right now, very many numbers of our children are not receiving the nutrition they need to grow well. So good news is, yes, happening, particularly in certain regions. For example, if we look at the minimal acceptable diet, indicator, we've seen great progress in East Asia Pacific region and in Latin America Caribbean region. And in fact, in those regions, particularly in the Latin America Caribbean region, we've also seen certain indicators also really improve, such as the prevalence of wasting. So there definitely is a strong evidence base where you improve the quality of young children's diets, you do see the improvement on nutrition outcomes. In many of those countries, there are very large social protection interventions that target nutritionally vulnerable households. So I think it's a great case to say, yes, there is hope, and yes, we can see change, but we are seeing that certain regions in the world are struggling, particularly Sub-Saharan Africa and South Asia, and we all need to collectively work together with the governments and with all of the donors and civil society to really support efforts towards improving complementary feeding. And I think those countries have shown some fantastic progress. And perhaps to say that since 2000 rather, in the last 20 years, we have 55 million stunted children less than we had that time. So we definitely are seeing progress, but there has been a stagnation in the last 10 years. So we need to rapidly ramp up efforts to improve the quality of young children's diet. And of course, the risk really is on the ultra-processed food that's now dominating the market share, and we must protect our children from those foods because this is not going to set them on the right path towards health and development that we need. Now, the second question on COVID, yes, of course, we've all experienced this extraordinary time. And what we did find when we reached out to our country teams to say what's been happening with your nutrition services, with your access to counselling, with being able to reach the children and the mothers that need services. In the first half of 2020, over 80% of our country programs, which is over 120 countries, reported a significant impact on service delivery. So we know for the first 6 months of last year, many children did not receive the basic services on vaccination, on counselling, on growth monitoring that they need to really develop. And in fact, one indicator that we are just now crunching at UNICEF, and we will be hopefully releasing in a report soon, is looking at the vitamin A supplementation. As we all know, we need to give 2 doses of vitamin A to young children to protect them, to meet their nutritional needs and protect them against certain illness. And normally, out of the 65 countries we monitor, we have
suddenly lost you, Grania.
Oh, apologies. Can you hear me?
Yeah, you're back again.
Okay, apologies. Normally, we have about a 61% coverage of 2 doses for the 65 countries. That was the coverage in 2019. 2020, it dropped to 41%. And most of that drop was in semester 1, which was the first 6 months of 2020. And sadly, most of that drop was in more fragile countries where they don't have these services as part of their routine health platforms. So those services relying on campaigns, child health days, not surprisingly, were the ones that were most affected by the drop in vitamin A coverage. So now we're trying to work with all of these countries to rapidly accelerate programs to get those kids vaccinated and protect them going forward. Thank you.
Thank you, Grania, for that. Dr. Bulbul, I said I was going to come to you next, and Paul, I'm also going to ask this one of you as well. I was fascinated that you said 22 ministries are involved, and nutrition, you're quite right, is not only an issue of the Ministry of Health. But tell us, when you have to have 22 ministries involved, how do you get to coordinate this in a manner that everyone is working in the same direction? To me, it sounds like a nightmare. Share with us some of the strategies in Bangladesh, which is also such a huge country with a really devolved kind of government. How do you do it? Give us some tips.
Thank you very much. First of all, introduce such, amazing initiation, you need a policy. So we have National Nutrition Policy. Then we actually prepared the National Plan of Action for Nutrition, as well as we have revitalized Bangladesh National Nutrition Council. Our Honorable Prime Minister is the chair of that council. So she actually convened all the relevant ministries. Actually, we have 45 ministries, but very actively participating almost 22 ministries along our journey. So this is very much important when you get the highest level of political commitment. That actually will help you much to improve as well as to engage all in your journey. Number two, as I have already mentioned, that Bangladesh National Nutrition Council actually coordinate all the ministries. We have developed same plan of action. So we have distributed to the all ministries. They also feedback with making some sort of action plan or year plan for the coming days. So every ministries have one focal point. He or she comes together. Those people comes together and make plan. As well as I have mentioned, we have district level coordination committee as well as Upazila level coordination committee. And this committee also consists all the representatives from the relevant ministries as well as civil society alliance, UN, donors, and finally the business networks, business networks. And finally, we have a good platforms of scaling up nutrition movement here. You know that 5 platforms. So government platforms works very strongly along with engaging all together. So finally, I want to finish here that when you have a good policy, when you have a good political commitment, then it is easier. But there is also challenges to work together. But I want to give one just example that ministry, disaster ministry, they never, found themselves that they have activities for nutrition. But when we told them that during any disaster or any crisis, you can actually make some sort of nutrition activities like providing the breastfeeding environment for the mother, lactating mother, as well as during this COVID situation, our government provided food for the poor people, but we advised them to provide nutritious food for the poor people. We made a nutritious package with the total calorie value. So this how we are, acting together to improve the situation.
Wonderful example.
Thank you.
Thank you so much. Paul, you were hearing that, and what's really important, and I think, is when we see that you sit in the Prime Minister's office. Tell us a little bit about how in Tanzania you're achieving that coordination, because I think you've also stressed the policies are important, but then the coordination on implementation also important. Give some of our other countries some tips on how Tanzania has really been coordinating so that these policies to improve infant and young child feeding don't just sit as policy documents, but become a reality.
Thank you very much, Jen. Not to live too different from Bangladesh, but in our country, at the highest level, we have a Prime Minister who is the top, because as you can see from my introduction, I'm coming from the Prime Minister's office. So Prime Minister is the one who sits at the top of the high level meeting. We usually annually arrange one meeting whereby the Prime Minister's chairs that meeting, and all other ministries concerned participate. So before that meeting, we have a high level steering committee. And this is the committee of permanent secretaries from all these ministries that are concerned in implementing these interventions.
Oops.
So
there you are, you're back.
They do come and meet, but also section to technical personnel. So below the steering committee of permanent secretaries, we have a coordination committee. The coordination committee, this is the committee of directors. So I chair that meeting, and all directors from other ministries do participate. So when you have issues, when you have report, we will also discuss before taking to the permanent secretaries and later to the meeting of ministers. But also we have focal persons, and this is a technical committee. Now, these focal persons come from all these ministries, and from the President Office, local government is the ministry concerned with the coordination of all regions. We have 26 regions, which also have focal persons. So the local government ministries do get reports from all these regions. So as other countries do, in every year during the beginning, we do have plans and budgets from all ministries and regions. So the ones from the regions are being compiled in the President Office, regional and local government authority.
Great. Thanks, Paul. I think you've covered that really well for us, and I'm going to
through the Prime Minister's office.
And it's great when you have a Prime Minister's office with really taking the lead, because then I think accountability becomes very strong. I'm going to move now also to our two other presenters talking about actual implementation. And I'm going to start with you, Meseret. There was in the chat box a lot of interest on the egg project. And the one that I'm going to pick up, and I see your colleagues have been also supporting and answering, but I really would like to perhaps pick up on the one question about the price, because I think people are always concerned also with, you know, price, and affordability is a really big issue. So are you able to, perhaps there is the answer in the chat box, but it would be lovely to hear about you on what is the price difference of an egg versus egg powder? Why don't we just feed the children eggs?
Thank you very much. This is a very important question. In fact, we are also concerned about the price. And as you know, there are, egg is not surplus in Ethiopia. It's somewhat, it's expensive, particularly for the low-income people. So that's why we have started this one to in line with the Sakota Declaration Oredas, where most of them are the PSN be covered, so that we want to really start up to provide them for free. Otherwise, we are always concerned to, when we change a policy at the highest level, we always see in the economic lens. So once we invest $1, $1, we need to learn what is the investment return. Always, we are really pretty conscious on this economic lens. So we really don't embark directly to implement whatever we have. Always we see from the sustainability aspect, from the cultural aspect, from the economic aspect, and also from the partnership, you know, from the acceptability of the community, from the religious perspective, from the culture, from the norm. So at the very startup, we provide the case of severe acute malnutrition, moderate acute malnutrition, we provide them Plumpy-Sup, you know, we provide them for free. So we're going to provide them through that channel for those they cannot be able to afford. But whenever, in line with this, we are going to work on the economic aspect. And also, for sure, it must be low price than the egg. Yeah, it adds value, but we will make sure that the egg is available in Ethiopia. This is one of the entry points to make the egg surplus, to support the users to have like an opportunity for job creation. You know, there will be a mass production of the you know, poultry and egg production. So we'll certainly link this with different aspects. Minister of Agriculture will do with that, and the Minister of Job Creation, Minister of Health. So there will be a certain collaboration. Thank you very much. Over.
Thank you so much. And I know that I'm going to ask your colleagues that they also said there's been a recent publication in the Maternal Child Nutrition Journal. So Arno, can you also put that in the chat box as well, so that people who want to access that can also get it from the chat box? That will be great. Anna, I'm going to hope that we're going to be able to hear your response to this question. So I'm going to keep the question short and sharp, and hopefully then we'll be able to hear the response. I'm going to ask you, what has been your greatest challenge in looking at a nutrition profiling model? And because we have the WHO on this call, what one piece of support would you feel would be really useful from the WHO for countries that are thinking of doing a nutrient profiling model? So your greatest challenge and the one thing you would love the WHO to provide countries.
Thank you, Jane. I hope that the sound will be better. Very, very sharp question, really. The greatest challenge was that WHO nutrition profile models demands the rather detailed information in order to evaluate the product, the baby food product. But in the case like it was in our country, then there is the lack of information in the package, then there is the gaps in the labeling legislation. Then it was a real challenge to make some final judgment, except that there is the lack of information. And so our request, and I think it will be not a problem, not only a problem of the Russian Federation, it can be the case in many countries, and the request will be to try to adapt to the nutrition profile model for using it in the circumstances with lack of information, with lack of data on the package of the products. Thank you.
Thank you for your short and sharp answer. So also what I'm hearing from Russia is that they're saying really important, if we're going to do nutrient profiling models, is for countries to start off by even having legislation to have nutrition information mandatory on the labels. So that's something that at a national level we need to see happen. And then really also from the WHO to help give support towards that. And especially, are there ways that we can make nutrient profiling modeling perhaps as simple as possible when there's not a lot of nutrition information? We might be asking the WHO to create magic that's not possible without the nutrition information. But certainly, I think your voice has been heard that we really need to have nutrition information available. I'm sure you will all agree that our panelists have been absolutely fabulous. They have been so willing to share their stories and to really explain to us what they are doing. So despite the fact that we might feel despondent, although Granya's made me now feel much happier, and despite the fact that we have a long way to go, we have seen from these countries that they are taking actions and beginning steps. So each of us should be inspired that we too in our own countries can stand up and become advocates for action as we move to the Nutrition for Growth Summit and actions around infant and young child feeding. So a huge thank you to our panelists. We really appreciate you giving up your precious time to be with us. And we look forward to that day when we aren't on a virtual plane, but we are coming in reality to your countries to see the projects and the programs you are doing. So thank you to our panelists.
Thank you.
I'm very happy to see on the screen Angela De Silva. Angela has been listening attentively to our session today and is going to give us the concluding remarks. Angela is the Regional Advisor for Nutrition and Health for Development in the WHO Regional Office for Southeast Asia. Angela, a champion and advocate of child nutrition and nutrition in general. So Angela, over to you for the closing remarks.
Thank you very much, Jane, and good day, colleagues. In the past 1 hour or more, we've had so much.
Angela, you've disappeared.
Can you hear me?
So Angela, your sound, let's see.
I can hear her well, Jane, yeah.
Angela, we can't hear you.
Others can hear me.
Yes, we can hear you.
I'm hearing some people in the chat box are saying that they are hearing you well. So maybe it's just me who can't hear you.
Shall I continue then, Jane?
Yes, and now I'm hearing you a bit better. So let's continue, Angela.
Right. Thank you. So in the last hour or more, we've had so much rich information shared by countries across the world on actions to improve complementary feeding. So thank you all presenters. Your information is guiding my summing up. The recent UNICEF report shows the unsatisfactory status of complementary feeding, and we are all aware of the multiple reasons, including food insecurity, poor access, feeding in practices, poor feeding practices, and increasing availability of unhealthy processed packaged foods. The issue is, how do we deal with this problem in practical terms? And we know that the COVID pandemic has surely impacted child diets and will have significant repercussions on nutrition status of vulnerable children everywhere. So countries need to prioritize complementary feeding and use innovative and game-changing solutions to address specific contexts, keeping in mind disparities within countries. And some of the examples given by countries today are hopeful and will encourage future work in other countries, we hope. So I would like to sum up a few key take-home messages from today's presentation. Evidence generation is absolutely vital, as we heard from all the countries, in order to inform policy and implement actions. The examples from all 4 countries showed how important it is to assess the situation, either at the level of policy, the different systems, or community level, or at all levels. For example, the Tanzania policy landscape analysis and development of the action framework, Bangladesh's analysis of the affordability of foods and their policy analysis, Ethiopia's assessment of the food and feeding situation with regard to dietary diversity, and Russia's evaluation and profiling of commercial complementary foods. Most countries we know have comprehensive policies, strategies, and guidance to support young child diets. But gaps are often present and need to be identified and rectified, especially in terms of policy coherence and coordination across multiple sectors. We heard about the 21 sectors in Bangladesh, for example, and in having robust and practical action frameworks and using a wide-ranging consultative process. As shown by most countries during this session, a large number of sectors are involved in supporting complementary feeding, and identifying and maximizing the use of entry points in other sector platforms to promote optimum complementary feeding is important. Even when there's robust policies and frameworks in place, there are many gaps in coordination across different systems. These are very common and affect implementation, and it needs to be addressed both at national as well as at subnational level. Collaboration with sectors should consider bold and innovative solutions. The consideration of the private-public partnership for research and development in developing and delivery of locally produced, accessible, and affordable food products is important. Like the egg powder example that we heard from Ethiopia, it's an important example of multi-sectoral collaboration involving health, food sector, private sector, and social protection. Consideration of the changing food environment is imperative, knowing the evidence from many of the countries on commercial complementary food products that are increasing in number and increasing in purchase as well. The nutrient profiling of commercial complementary products is important not only for the country as Russia showed, but also very often for neighboring countries to which these products are imported to. And this profiling would guide the development of legislation and standards on labeling and promotion of commercial foods, which is important to drive both product reformulation towards healthier food profiles, which will have a positive impact on all forms of malnutrition. A final but important message that for all these actions, high-level political commitment and government-wide leadership is vital to implement comprehensive policy measures. And this is often supported also by the global and regional mandates and commitments. I'm sure that this session has resulted in good learning for our audience in terms of both challenges and successes. We hope that the information from this session would support greater commitments towards improving complementary feeding across countries in the coming months before the Nutrition for Growth Summit in December 2021 and beyond. I would like to thank all our presenters, the audience, the backup support, the country teams that supported the presentations and helped organize and help the presentations of the countries, and have a good day. Thank you very much.
Thank you, Angela. And yes, indeed, thank you to UNICEF and WHO for hosting this session. I do want to remind you that there is another great session tomorrow at 1300 hours Central European time, which is on a fresh look at micronutrient malnutrition, maintaining progress and addressing new challenges. So please, if you are available, that will be another great session. Thank you all for being with us, and please stay safe wherever you are until we meet again. Goodbye and thank you.